deserve attention and what it actually takes to make them work. Every week, some new idea spreads across our industry. The question is not whether it's popular, the question really is, are we ready for it? Hi, I'm Bruce Spurlock, a physician and healthcare leader who loves and is committed to helping professionals and decision makers navigate change with clarity. On viral healthcare, we look at the ideas spreading across healthcare and what it takes to implement them or not sustainably and wisely. This podcast exists for one reason and one reason only. Healthcare moves quickly, sometimes too quickly, but implementation often moves slowly. We see a lot of trends coming across our desk every single week. Things like new platforms, new ideas, new systems, new practices, a bunch of news out there that comes across, and a lot of organizations feel pressure to adopt them and adopt them rapidly. Sometimes the pressure is outside, it's external. Sometimes the pressure is competitive. We don't want to get beaten by the organization down the street. And sometimes it's just cultural, the way we've been doing things all these years. But what often gets overlooked is the operational reality and the decision making behind those new trends. Let me just say right at the beginning, viral healthcare, we're not anti-innovative. I'm an early adopter. I like new innovations. I like the bright, shiny objects. What we're not is we're not anti-change. In fact, a lot of these trends deserve serious attention and very thoughtful evaluation. What this show is about is discernment. How do we know what's the shiny object and what's really going to help your organization, help patients, and endure for the next 10, 20, or even 30 years? Over the next series of these podcasts, we're going to examine what is driving a trend. Is it one of those shiny things that has a lot of hype, a lot of buzz, or is it Memorex, to show the term back from when I was a kid? We're going to talk about who benefits, what it really takes to operationalize these new trends to make sure that they work, what hidden costs may exist. First, if we're successful, and more importantly, what happens if we fail. And I know that none of you ever fail. I've never failed, not just joking. I've seen a lot of things fail, a lot of new ideas, a lot of flavors of the month. We're going to talk about those and what the hidden costs are around that and how we can approach change very thoughtfully. Because one thing I've known is popularity is not the same as preparedness. And speed is not the same as sustainability. So that's what we're going after: wisdom, discernment, preparedness, and sustainability. So let me talk about why I decided to do this podcast. It's been many years in the development, and it's kind of interesting to think about where it came from. I worked with a lot of executives, hundreds, maybe even thousands of executives. I worked with boards, governing boards. I worked with physicians, nurses, and quality leaders, both in leadership and at the front line. And I've noticed something consistent. When a new initiative launches, a new program, a new method, a new practice, a new innovation, there's often a lot of excitement at the top. But throughout the organization, it's uncertainty. And that's important to understand. We studied this. We actually saw where the leadership at the top has a very different view than things going on at the front lines. And it's important to bridge that gap. So people might ask, why are we doing this? What problem are we really trying to solve? And more importantly, how will this affect my work, my role, my organization, and potentially my future? Because if you're like me, you're started off thinking like healthcare is a great place to grow and learn and develop and rise up in an organization or in leadership. But what does it take to be successful in that? And more importantly, how is this different than all these other podcasts, all these other organizations, all these other trends that we've looked at right now? So first of all, let's just acknowledge there's pressure in healthcare. There's financial pressure, there's competitive pressure, there's performance pressure. When something goes wrong in the system is criticized. People are criticized. When change is slow, the system is criticized. People are criticized. When change is fast, the system is criticized. People are criticized. So we're not going to get rid of criticism. We're not going to get rid of the external view that we've got a lot of improvement to do. What we're going to focus on are what we can actually get our arms around and make a difference and let the results speak for themselves. It can be hard to be a decision maker in this kind of environment. And that's what we're going for on viral healthcare. How do we make better decisions? How do we make more thoughtful decisions and jump on a trend or an innovation at the right time for the right reasons with the right confidence that we're ready and prepared to do this? Most of all, we want you to feel supported and not attacked. Okay, so what do I hope that you learn? What do I hope that you take away from this? And that's what I always like to say. 5 years from now, you're going to say that crazy guy Bruce said this stuff, and I actually remember it. That's kind of what I'm going for with this podcast, is to take things that you actually kind of use and remember and are important because they resonate with what you think is actually happening. First, I think three things should happen if you listen regularly. First, I hope that you become more comfortable asking better questions about new ideas. Better questions about new ideas. Not, is it exciting? Does it sound sexy? Are a lot of people doing it? Is this an unbelievable answer to my problems? Because it often feels like that. But the real questions I want is it durable? Is it feasible? Are we ready to be able to do that? Second, I hope you recognize your role in implementation, because implementation doesn't just happen at the front lines. It doesn't just happen in the middle of the organization. It doesn't just happen when a leader says this is what we're going to do in the future. Innovation doesn't succeed just simply because it was announced. This is our new direction. This is the new thing we're going to be implementing. It doesn't just happen that way. It succeeds because professionals all across the system engage with it, understand it, shape it, and endorse it, and adopt it, and believe in it, and think it's worthwhile because it provides real, improvable, measurable, tangible outcomes. Your judgment matters, your insight matters, your experience matters. Third, I hope this becomes a space where we can strengthen healthcare from within. I'm looking forward to this dialogue. It's not just a one-way street. I hope that you contribute and bring your ideas. I'm looking for people to share the trends that work really well in their organization, and let's explore in depth the things that failed. Because frankly, I know each and every one of you has watched a new idea, a new practice, a new innovation, a new system, the grandest thing from since sliced bread that has failed. And I'd love to be able to talk about what makes things sustainable, what reduces chaos, and how we can influence chaos and burnout that results when some of those things happen. So clarity is super powerful. Informed professionals are powerful. You can be even more powerful. So I want this to be a conversation. Each Tuesday, I'll be hosting a live session on LinkedIn where you can join, comment, and ask questions in real time. This is not a one-way street. This is, as I mentioned, a dialogue, a conversation. We learn from each other. I'll have experts on from time to time, and we'll interview them and have ideas back and forth. But I really do think the audience brings a lot of expertise, especially in the area of understanding why things fail. It may be more challenging to really think back and say, wow, I never even knew that this was an innovation 5 years ago, that now we're just doing like regular work. But that's how it happens on the successful ones. We don't even notice that we're changing in some of those situations because it happens incrementally, it happens comfortably, and it becomes just the way we do work these days. So we're going to keep the Tuesday session focused to just 20 minutes or less, something that you can get in a little bit depth. We can show you places where you can look for more information, but we'll have a reflection later on in the week. On that reflection, I'll ask you questions and ask myself, did we do any of these things? Did we learn something from this last 20-minute session? And if you want to encourage to join live, you can do that. The discussion is richer when we have a lot of perspectives, when the audience, you are contributing to the dialogue. So I'd love your input. Tell me what trends you're seeing now. Which things kind of look really promising? Which things look really scary? For example, I go to meetings all the time and I ask how many people in the audience are excited about AI. And about half the audience raise their hand. And I ask how many people are scared about AI, and about half the audience raise their hand. Every once in a while, some people raise both hands. And of course, I start laughing because you can be both excited and scared about AI. But we'll talk about that. And we won't talk just globally about AI. We'll talk specifically about tactics and trends and things that are coming up. Which ones of these new trends and ideas feel super rushed, super pressured, super under competitive or cultural, or just because the Joint Commission or the federal government or my boss said we have to do that? You can also comment on LinkedIn. You can reach out directly. And more importantly, I love it if you would suggest topics for future episodes. I'd love to dive into the questions you have, the challenges you face, the problems that you've come across, the disruption that just scares the pants off you. And let's look at that in more detail. But the goal remains the same. Just remember, this is what we're all about: clarity over noise, signal over noise. We're not going to kind of get caught up in all of the buzz and hype. We're going to kind of try to ignore that to the extent possible. It's almost like you have to turn off all the stuff going around on you just so that you can focus. Or you have those noise canceling headphones. We're going to try to be the noise canceling for the way you think about decision making with this kind of a podcast. So let me just talk about a few of the things that we're going to talk in the future. We're going to talk about what defines a trend. In fact, that'll be the next one. What is a trend? What does it mean to go viral? How do we know it's going viral? Is viral something that happens overnight, or can viral be something that blasts out over a year or two? When do viral things turn on? When do viral things turn off? What's driving it? What are the promises? What are the hidden things that nobody wants to talk about? It's interesting when you get this buzz a lot of times on a new practice, a new intervention, a new system, a new platform. There's a lot of discussions about what it can do. And that's important because you have to understand what the benefits are. But there's often very little discussion about what the costs are, where the danger zones are, where the potholes are in the drive. So let's talk some about that. We're going to look at some interesting ones early on. We're going to look at this thing called rapid response team, something that came out around 2004, 2005, and here 20 years later, we're still doing it. But at the time, everybody thought this wasn't a trend. This was hype. And there were some research articles to talk about that as well. We're going to look at those kinds of things as we go forward. So what I want to recommend you do is to continue to bring ideas to this discussion, and we'll examine them. We'll look at what the literature says. We'll look at what your experience says. I like this idea of evidence-based medicine, but the evidence isn't just a randomized, controlled, double-blind study. That's certainly one piece of evidence, but a lot of evidence is what you're seeing on a day-to-day basis in your organization and in your life. And I'll bring examples from all across the country, perhaps even across the world, of real life places that have both succeeded and failed. And we'll try to understand what were the differences between that. That's about implementation. And the kinds of things that we're going to explore also is, how does implementation go successfully when you should be adopting a new trend? You should be adopting something that's really well developed, and why you may be struggling to do that. I can't tell you how many people I've hit improvement plateaus, implementation plateaus, major pushback from the people they work with throughout the organization. The organization may get pushed back in the middle, or sometimes the organization in the middle of the organization, the people that are there, just kind of like ignore it because it'll go away. It's another one of those flavor of the month kind of thing, and it'll go away. Or I'll just outlive the CEO and this idea will die on its own in a couple of years. So, those kind of things happen. We're going to be looking at that as well. My background, some of you may know me really well, and some of you may not know me very well. I practiced medicine for almost 10 years with Kaiser Permanente. I was one of those frontline physicians, both in the hospital and in the ambulatory setting. So I got to see healthcare over time, and I got to see the most scary and frightening and challenging and exciting things going on in healthcare in the hospital setting. I was able to join the California Healthcare Association, where we looked at statewide quality and policy in California. I met leaders of all different types, in all different types of organizations, from purchasers and health plans, from hospitals and health systems, from medical groups and physician practices, from nursing homes and long-term care associations. I met people all over the state of California. It was a great introduction to understanding the complexities of the healthcare system. And it's interesting, the same forces, they might be different innovations, they might be different practices, but the same forces apply to everybody in healthcare, no matter where you sit in the process. I then started my own consulting practice where I worked with individual organizations on quality improvement and safety and some of those kinds of things. And then we went national. We started working with the American Hospital Association on a national initiative to improve quality in like 1,700 hospitals simultaneously. How do you think about that? How do you get 1,700 hospitals to move and change all at the same time? One of the most exciting periods of my life. We did that at a national basis. Really had a good time doing those, and really saw some constructive improvement processes be implemented. And we saw people struggle, and we helped those people struggle, and we helped them learn from the people that weren't struggling. So it was an exciting thing to talk about accelerating change at scale. Now I'm focused more on helping organizations navigate complex systems, navigate implementation, and more importantly, this decision making about navigating change. How do we do it? How do we do it with discernment? And how do we do it with clarity? So I'm just going to wrap up now and close, and let you write things in your comments. Give me some feedback directly. Come and tell me what you would like to have done on the next few episodes. So first, let me tell you the next episode, we're going to talk again about what trends are, what defines them, and what does it mean to be viral? What does it mean to go viral in healthcare? So thanks for listening to me on Viral Healthcare. I'm Bruce Spurlock. If this conversation was useful, share it with a colleague. I'd love to be able to get more people involved. And if they're navigating change, this is the perfect place for them. And if you want to follow through about conversations with me, be sure to let me know and follow the show. Until the next time, I'll see you then.